Well, good evening, everybody, and welcome to another edition of Ask the Doctor. We are so excited. Tonight, we're going to learn about optimizing hormone balance. And we have a fantastic teacher here with us this evening. And he is someone who teaches, lectures, and trains doctors all over the world. And we are super, super blessed to have him. Dr. Bob, are you ready to teach us some wonderful things?
I am ready. Happy, beautiful evening all. And Carol, thank you. Always on time, always welcoming. And thank you. You are just wonderful for our world. So tonight we're going to talk about optimizing hormone balance. And hormones get a lot of press, but really, they are one of many ways that the body has to communicate. And there's a lot of factors that will determine whether or not our hormones are working ideally or not. So a little bit about me. I've been in clinical practice now. This is my 30th year. I have worked with both ends of the spectrum. These are some of the world champion athletes that I've worked with. In fact, I've worked with world champions from every major professional sport. I've also taught over 10,000 hours of continuing education seminars to doctors all over the world. I was at a conference, it seems like it was about a decade ago, and they had a multiple-time world champion athlete as the keynote speaker. And someone asked him, they said, how in the world somehow I became muted. At least I got a sign on my screen. They said the only way you have energy is to earn energy. And I thought, you know what, that's also true of health. If you want to have health, you have to earn health. So for years, I've talked about the Magnificent Seven. You've got to eat right, drink right, think right, move right, sleep right, poop right, talk right every single day. And we're going to focus on the talk right because that's really what hormones help our cells and body to do. They help us to talk right. And think about it, you're made up of over 50 trillion cells, and every one of those cells is like their own little entity. They're a community of beings that want to make everything better for everybody. And so good communication is absolutely critical. So when we're talking about hormones, we're talking about the endocrine system. That's a broadcast message throughout the body. But believe it or not, our cells also talk to themselves on a regular basis. That's autocrine function. And our cells talk to their neighbors. That is paracrine function. And so, we always want to be a good neighbor. And often I'll be lecturing to a live audience. I guess, this is a live audience, but at a distance. And who knows, maybe we'll have a couple hundred people in the room and I'll say, look, I noticed that no one's sitting on anybody else's lap here. And in fact, I don't think I've ever seen anybody sit on anybody's lap at a seminar, right? But that's because we all respect each other's space. And by the way, we also respect each other's property. When it's lunchtime, you don't go and take whatever you want from anybody else's plate. So there's that level of respect. But one of the first things that happens with cancer is a loss of cell-to-cell communication. Cancer cells don't respect other cells' space. They crowd in their space, they invade their space, they steal their food, and then they actually poop and pee all over them, right? So they're really, really bad neighbors. And so one of the ways that we can prevent cancer is by optimizing cell-to-cell communication. One major factor in communication for enzymes and hormones is for the body to have ideal pH. When you study acid alkaline balance in school, I really think they brush over it because blood pH is relatively stable, but you would be amazed at how much variability there is at cell pH and intracellular pH. And as the body becomes progressively acid, illness tends to settle in. So I read this book years ago called Alkalize or Die, and a good book that tells a very powerful story. I like to look at the flip side of that, alkalize and thrive. So there's medically proven data on an alkaline diet, which would enhance cell-to-cell communication. And notice that it actually reduces tumor cell invasion and metastasis. So it keeps a little bit of the communication in cancer cells going ideally. And the acid alkaline buffer is one of the most important things for athletes as well. When you're doing intense physical exercise, you make a very strong acid called lactic acid. And if you don't neutralize that, that will slow you down. So Tyson Gay, very fun case, great patient, American record holder in the 100 meters. And shortly after I saw Tyson Gay, he beat Usain Bolt straight up in a 100-meter race. And I've got a nice video of him giving a testimonial on that. But really the primary thing that we did was alkalize him. We won't talk much about cancer today, but we will touch on it. The perfect storm of cancer is low oxygen, low nutrients, high acid, chronic inflammation, and immune suppression secondary to chronic distress. And if we alkalize the environment around a cancer cell, we reduce its invasiveness, we reduce its metastatic capacity, and then we enhance the killing effect of chemotherapy. So alkaline diet at that end of the spectrum is very, very important. So great for high-level athletes and great for people that are fighting for their life with cancer. So my most favorite, most alkaline food just happens to be Ganoderma lucidum, widely held to be the most alkaline food on planet Earth. When we look at hormones, there's a lot of people, that have their own impression of what they think the master hormone is in human physiology. And I actually happen to think that it's our stress hormones, because we are always built to survive. And if we ever get in a stressful circumstance, whether it's real or imagined, our body will trigger a fight or flight response. And when that happens, we'll have increased stress hormones. So the acute stress hormone, they call it adrenaline. It's technically epinephrine and norepinephrine. Chronic stress hormone is actually cortisol. And we're going to talk about that quite a bit. And when your body's in the stress response, you will actually decrease growth hormone. That's for maintenance, repair, growth of new tissue, and even fat burning. Thyroid hormone, which controls the metabolic rate of 99% of the cells in the body. We also decrease the sex steroids, estrogens, progestins, and testosterone. So one of my favorite authors is a researcher named Robert Sapolsky. He wrote a book entitled Why Zebras Don't Get Ulcers. And he says, look, if you're running for your life, this is not the time that you want to procreate, that you want to repair things, that you want to grow, or rely on slow energy production. And by the way, fat burning, even though it's our most sustained fuel source, it also burns very, very slowly, whereas sugar is very, very, very fast energy to fight or flee. So a lot of things that chronic stress or cortisol does. It weakens the immune system. It can cause brain challenges, including anxiety, depression, headaches, changes the neurologic system's firings, even breaks down the brain, causes digestive challenges. Cortisol actually raises blood sugar, so that can cause blood sugar problems, increases the blood pressure so you can fight or flee, and ultimately that can lead to heart disease. And then here's one of the most distressing things about our society. This medical publication says that nearly everybody has elevated cortisol and cortisol resistance. So when I talk to doctors, they're very familiar with the term insulin resistance. And what that means is your body releases so much insulin in response to inappropriate diet that the cells actually begin to ignore the signals of insulin. When the body begins to ignore the cortisol signal, we actually lose some good benefits of cortisol, like anti-inflammatory response, and excess cortisol leads to chronic inflammation. The extreme of excess cortisol is called Cushing's syndrome. And there's a lot of things that happen that are not good at all in the human body. So I was at a lecture on stress years ago, and an Indian researcher said, the ultimate curse would be to tell someone, may your cortisol always be high. Well, sadly, that seems to be the case in a lot of our population. So a few decades ago, there was a two-sport athlete, maybe the best of all time, named Bo Jackson. And on one football game, he just happened to be making a very routine run. He got tackled and he had a fracture and dislocation of his hip. Well, and then by the way, he never was the same ever again. He tried to make a comeback, but it wasn't very effective. And what they found out was he was taking corticosteroids, anti-inflammatories for his two-sport injuries. And that led to osteoporosis, bone thinning, and that ultimately ended his career. So back to my favorite herb, Ganoderma lucidum, or superfood, it actually prevents the dexamethasone-induced osteoporosis. Now, If you're not medically minded, you might not know what dexamethasone is. Dexamethasone is one of the most powerful corticosteroids medically available. It's what they use for altitude sickness. It's 30 times stronger than cortisol. So if Ganoderma can prevent the hardest corticosteroid and its negative effects on the body, imagine how it can buffer the stress within you. So with the sex steroids, I showed the graphic early on, but here's a fact. You're either making sex hormones or stress hormones, not both simultaneously. Remember, if you think you're running for your life, that is not the time to procreate. There's a picture of Robert Sapolsky, a phenomenal author, Stanford researcher. He would live with primates in Kenya, East Africa, parts of every year for over 2 decades, and he would study mammalian stress response. And this was a very technical book entitled Stress, the Aging Brain and Mechanism of Neuron Death. But here's a simple fact. If you run on high stress, you age your brain and you kill your nervous tissue. And by the way, the section of the brain that is most vulnerable to the chronic effects is memory. And so there is cortisol-induced Alzheimer's. So what's a good strategy for buffering stress? Well, the first thing is actually take a deep breath. If you actually have the time to take a deep breath, that automatically puts your body in a relaxed state, in what's known as a parasympathetic state. And then I'm going to share a couple other strategies. One of my favorite things is to do hourly doses of melatonin. Melatonin actually prevents our brain from driving the stress response on our adrenal glands. So I usually recommend 1 to 2 milligrams of melatonin every waking hour. Theanine is an amino acid in green tea. It's very, very good for mental stress. It increases the most calming brain chemical known as GABA. And then we've got Ganoderma that calms the body, the mind, and the spirit. And since all these are very, very safe, I always tell people bodies respond to frequency, duration, intensity, quality, and timing of stimuli. So I like to do anywhere from 7 to 10 days, melatonin, 1 to 2 milligrams, theanine, about 200 milligrams, and Ganoderma spores, 250 to 500 milligrams every waking hour. And you'd be surprised at what a wonderful stress reset people get with that. Now let's talk about other sex steroids. Males, when they make testosterone becomes something called dihydrotestosterone. The enzyme is called 5-alpha reductase. Now, women can also make this DHT as well. And when they do, they can have male pattern baldness. They can actually get hair growth and other challenges there. Men, by the way, will get baldness, and they can also then have extreme prostate challenges. So Ganoderma is a very powerful modulator of 5-alpha reductase, and that is actually really, really good for the male prostate and can shrink the male prostate. And the extreme of that, prostate cancer, 40 different medical studies going back over 20 years on the effectiveness for Ganoderma lucidum and prostate cancer. When we look at young ladies, they are developing very, very, very rapidly. This was a Time cover story, early puberty, why girls are growing up faster. Well, they're asking, is it hormones? Yeah, it's hormones. It's estrogen. Estrogens in plastics, estrogens in pesticides, estrogens injected into animals. And the more body fat that you have, fat has an enzyme called aromatase that converts testosterone into estrogens. So both men and women with excess body fat have increased endocrine problems. So because of all the estrogens that are out there, it's been said that we are swimming in a sea of estrogens. And then guess what? My favorite herb, again, Ganoderma lucidum, helps to clear toxic chemicals from the environment, including toxic estrogens, bisphenol A, which is probably the most studied of it. When you look at estrogen in breast cancer, the top cancer in women, estrogen does not feed breast cancer. Breast cancer eats sugar. Cancer eats sugar. However, estrogen blocks a protein called MLK3, and that prevents the death of the cancer cells, and it actually makes them more resistant to chemotherapy. So that's why medicine likes to use estrogen blockers. There's wonderful natural estrogen blockers and ways to process estrogens. So I taught a series in the early 2000s with a medical researcher who was an OB-GYN, and he used to tell people, estrogens, whether you make them, whether you take them, you need to get rid of them every day. And I tweaked his statement. I said, whether you make them, whether you take them, whether you're knowingly or unknowingly intoxicated by them, whether you're a man, whether you're a woman, you need to get rid of them every day in a healthy way, because the new data is that estrogens are causing tons of problems in women, whether we're talking menorrhagia, dysmenorrhea, endometriosis, fibrocystic breast, depression, autoimmune thyroid, breast cancer. They also cause a series of problems in men, probably the top problem being sexual dysfunction and prostate challenges. And, you know, what I always encourage people to do is get every color of every plant every single day, because the data is clear. Different colored plants have different nutrients, and every one of them has some specific benefit in cancer fighting. So when you get good synergy among all the plants, that is your best protection. While we're back on toxins, Ganoderma is proven to help clear some of the worst toxins known to man. A toxin that's known to cause Parkinson's in a single dose, Ganoderma prevents that. Something that causes liver failure in a single dose, Ganoderma prevents that. Something that causes pancreatic failure in a single dose, Ganoderma prevents pancreatic failure. And something that causes neural tube defects in 80% of offspring, in a single dose of Ganoderma knocks it to 20%. So this is a very powerful agent for detoxification. 68 different studies on the effects of Ganoderma lucidum in breast cancer. And to my read, it's proven against a number of cancers: breast cancer, inflammatory breast cancer, prostate cancer, leukemia, lymphoma, multiple myeloma, cervical cancer, melanoma, lung cancer, pancreatic cancer, colorectal cancer, liver cancer, the most aggressive brain cancer, glioblastoma, endometrial cancer, gastric cancer, bladder cancer, small cell lung cancer, et cetera. So definitely something that we'd want to have as part of our daily routine. There's a lot of endocrine connection to storing body fat. This graphic calls out insulin. Elevated insulin puts the body in a fat storage mode. Decreased thyroid function puts the body in a fat storage mode, and increased stress puts the body in a fat storage mode. So this reference shows that when insulin is high, the body becomes in a fat storing mode, and Ganoderma actually reduces insulin resistance and reduces body fat. And when we start looking at type 1 diabetes, they can induce it in the animal model, but they found that Ganoderma prevents type 1 diabetes, whether it's induced by a toxin or by an Epstein-Barr viral infection. And by the way, the top type 2 diabetic drug in the world is called metformin. Metformin has a number of serious side effects associated with it. Ganoderma works by the same mechanism as metformin, but instead of negative side effects, has multiple side benefits. A lot of people think of the thyroid as being the primary organ in metabolic challenges or in fat storage. Thyroid is the most environmentally sensitive organ. A lot of toxins can disrupt it. Food sensitivity can disrupt it. Stress can disrupt it. And all of the known causes of hypothyroid are positively modulated again by Ganoderma. You know, so I asked this question: what if every sip of a healthy coffee, tea, hot chocolate, or shake improved your health or hormone balance? And the literature is overwhelmingly clear that it can do that. Wouldn't it make sense to do that? By the way, Ganoderma is perfectly safe for pregnant women. No known drug interactions, no known toxicity. And now we transition to questions and answers. So my wonderful friend Carol, do we have anything in the chat?
Yes, we do. We already have a couple of questions, and I'm sure a lot more will come out. So Karen was remarking last time we were talking about the coffee enemas. She's asking if King coffee would be the best option for that.
Probably, you know, so the king of coffee has the spores within it, which is the most potent part of the plant. It's also USDA certified organic coffee. This might sound like a very strange question if someone's not familiar with coffee enemas, but the primary job of the liver is to detoxify the bowel. There's a blood connection from the liver to the colon. It's called the portal plexus. When you put coffee in your backside, and by the way, room temperature, please, right? Not hot coffee. Then it goes directly to the liver, and it causes the liver to dump bile and toxins. And by the way, there's a very significant percentage of people when they drink coffee the other way, it stimulates a reflex where within 10 to 15 minutes they're wanting to use the restroom to have a bowel movement. So from either end, coffee seems to be good to help people clear. From the backside, it's more powerful to clear the liver. And yes, King of Coffee would be the best choice there.
Okay, perfect. So one of our friends says my bilirubin level is slightly high. Can fasting help bring those levels down, or is fasting actually dangerous? Would spores help with the bilirubin?
Well, every case you got to look at individually. There's a chance fasting might help. There's a chance that fasting might hurt. It's fascinating that detoxification is nutrient dependent, energy dependent. So if your gut is the source of the toxins and what you're putting in the gut increases the toxic burden, well, then fasting might be good for you. But if you already don't have enough nutrition to clear it, then you probably do want to do some good food choices. But Ganoderma is very good for the liver, and bilirubin's a normal toxin. If it's elevated, the liver's not clearing it as well as it could. I would think that good dietary choices, Ganoderma orally and coffee enemas would be a good choice.
Okay. Kathy asks, would you prescribe hot chocolate for an adult who stutters, or would you prescribe a different protocol?
Well, it's interesting that they asked the question that way, because we have a handful of testimonials on stuttering with kids and hot chocolate where it worked really, really well. And so I have not seen that study where it says Ganoderma can help stuttering, but one of the most famous cases ever is a gentleman named Paul Stamets, and his nickname is Mushroom Man. He's got a TED Talk entitled 6 Ways That Mushrooms Will Save the World. Interestingly enough, what he didn't realize is that mushrooms can make the world wealthy. Ganoderma is a $2.5 billion a year product. That's US alone. And medicinal mushrooms are a $50 billion per year annual product. So very effective there. But I don't know that it was the hot chocolate directly. I think it was probably the Ganoderma, but whatever this person likes to drink, do it consistently and see where that goes. And what's fascinating is most people that stutter, when they sing, it activates a different part of the brain. And that is a very well-known way to reduce stuttering in a lot of people. And now if you could only learn to, sing and talk simultaneously, I think anything's possible. Give it a shot. But certainly whatever they would do consistently is going to be a very good choice for them. Maybe we'll have a great testimonial coming there.
Perfect. Would spores alone rid the body of parasites, or would more things be needed?
Well, when we look at Ganoderma, it has over 430 uniquely identified molecules, 79 of which are antimicrobial and can be very synergistic, and they also increase the immune response. But every parasite is different, and I guess you don't know until you try. And so, I've seen people that have had very, very significant challenges with parasites, and doctors in the West, this part of the world, don't seem very well versed in it. But here's a fascinating thing. Veterinarians are very good with parasites. So I've had a few people, all their blood markers showed very serious parasites. We seem to have a hard time getting after it. They actually took a stool sample to a veterinarian, paid him for a consult, and the vet, made a simple recommendation for something that was very specific for the parasite and wiped it out quick. So give the spores a shot, but consider, other health professionals, especially veterinarians, who are most knowledgeable in that.
Okay.
Certainly Ganoderma and spores are a first do no harm strategy.
Perfect. What is a good protocol to treat childhood obesity? Perhaps the shake plus spores, they asked.
Well, that's a good start. Ultimately, we need to figure out what's causing the problem. Is there an endocrine challenge? Is there an autoimmune thyroid circumstance? Often the diet isn't ideal. What's the role of stress there? Are there environmental toxins? There's a quote from the medical literature: all toxins inhibit mitochondrial function. That is where fat burning occurs within organelles called the mitochondria. And so, case by case, but a very simple start is going to be our transformation program, get in the transformation group, do a couple of shakes, very, very nutrient dense, high quality biologic, grass-fed organic whey protein, and make good dietary choices and see where it goes. But, sometimes if there's a significant challenge, there's a missing element, and a good practitioner or someone who really listens to the patient can help to figure that out.
Okay. Natalie asks, what are your top tips for women suffering with hot flashes at night?
Well, so I like to tell the story of menopause, and I jokingly say, I don't know why they call it menopause, because women get it too, but in men, we call it andropause. And so, I tell the story when a little girl is born, and I have two beautiful granddaughters, one's just over a year and one's 6 months old. They're born with 1 million eggs in their ovaries. But eggs have a shelf life. Human eggs have a shelf life. So by the time the female is 37, they're down to 25,000 eggs. By the time they're down at 52, they're down to 0 eggs. The Swedish term for ovaries is egg stockers, which is such a good term for it. And when the eggs run out, when the shelf life on the eggs is run out, then the egg stockers close shop. The ovaries are no longer making the estrogens or the progestins. But the adrenal glands, the anti-stress glands, make DHEA, which is a precursor to estrogens, androgens, and progestins. And Natalie, you might be familiar with the term intracrinology, not endo, but intracrinology, meaning that all the cells of the body that need these hormones can actually make them. But when we start dealing with hot flashes, we want to buffer the stress to revitalize the adrenals. So my stress protocol is very, very good. Melatonin every hour, theanine every waking hour, Ganoderma spores every waking hour. And then there's a Siberian rhubarb in a product called Estrovera from Metagenics, which is a very powerful modulator of hot flashes. And I'll have people take 2 Estrovera every waking hour. And sometimes for a week, I've had people go from 30, 40, 50 hot flashes a day to at the end of the week, getting down to 1 or 2 with the adrenal reset and the Estrovera. And I always tell people it's easier to stay out of trouble than get out of trouble. Once we get them out of trouble, it's a lot easier to maintain. So those 4 things would be what I would do.
Perfect. Will Ganoderma have a negative interaction with metformin?
No known drug interaction, no known toxicity. So here's the issue. If it works by the same mechanism, what this person might see is that their sugars are dropping faster. And what I'd really like to see is everybody that has diabetes become very educated on how they feel when their sugars are either up or down a little, have a regular glucometer where they can check it at will. And we have plenty of people, they say, oh my gosh, when I take this, my sugars drop a lot. Well, now you have a choice. Do you drop a drug, which is very expensive and has a long-term downside, or do you drop a nutrient which nourishes every cell in your body, mind, and spirit? And keep in mind, my office is called the Natural Medicine Center. They say, wow, I think I'll drop the drug and I'll go with the natural stuff. And keep in mind that, we've made so many advances in type 2 diabetes. The typical type 2 diabetic is non-diabetic in my office in 60 days. And that's off of medication. That's what's typical. So lots of things we can do. Exercise, ketogenic diet, stress management. These are part of the game plan as well.
Perfect. Amy's dad has Parkinson, wonders what kind of form of Ganoderma would help him the most, coffee or the pills?
Well, I would go with the spores and the coffee. They're going to do coffee all the time. There was a study years ago that people that drank the most coffee actually got the lowest amount of Parkinson's. There's actually a way that it is dopamine sparing, and that's very important in and of itself. But the medical literature says that Ganoderma spores are anti-Parkinson's. So there's a book entitled The End of Alzheimer's. And keep in mind, Alzheimer's was written because it's a lot more common than Parkinson's, but it's a very similar process in a different section of the brain. And what Dr. Dale Bredesen would teach is that whenever there's a brain problem, Parkinson's or Alzheimer's or whatever, there are 3 distinct zones of nerve cells. There's cells that are dead. Well, there's nothing we can do about those. There's cells that are fine. There's nothing we need to do about those. But in between our cells that are functional but not functioning, if we can get back function, we can get back function. And we've done that with many Parkinson's patients. And so we, prevention trumps cure. If someone starts showing signs of Parkinson's, we want to do a whole brain and body program. And by the way, sugar is very damaging to the brain. Inflammatory process is damaging to the brain. Stress hormones are damaging to the brain. Toxins are damaging to the brain. So we want to address all those factors as much as we possibly can.
Susie'd like to know if the spores can cause someone on metformin to feel nauseous.
Well, they could cause someone on metformin or not on metformin to feel nauseous. So the symptoms of chronic poisoning include fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, or anxiety. So when you look at GI distress, nausea is one of those things. So as your body's eliminating toxins, you can get a headache, you can sweat, you can have nausea, you can have vomiting, you can have diarrhea. But when you put something good in your body and something unfun happens, my general assumption is your body's starting to clear something. So what do? Do we slow down the process? Do we do accessory things to help the detox, like a potential coffee enema? It's all up to the person. I generally encourage people to work with someone if they're dealing with a significant condition that's very well versed in detoxification, and help them get through it. Because once it's out, it's out.
Okay. What would be beneficial for hypothyroid who's experiencing weight gain, decreased energy, and poor sleep?
The most common cause of hypothyroid is actually autoimmunity, Hashimoto's, and there's a lot of different risk factors for that: food reaction, infection, environmental toxins, xenoestrogens, heavy metals. And so Ganoderma is good for all of those things. You would want to have a comprehensive thyroid profile, including thyroid antibodies run. And then there's 4 universal immune modulators. Ganoderma is one of them. Another Chinese botanical called periliseed is another. DHEA, that adrenal precursor, adrenal steroid, is another, and vitamin D is the 4th. And so I put people on all 4 of those. In fact, I did a consult today with a guy that so far, we've had about a 90% reduction in his thyroid antibodies in the last 6 months, and pretty close to normal. And he's feeling dramatically better. And so anything's possible with the right program.
Okay. Patty's daughter has stomach and head migraines. She's controlled with 2 different medicines. The coffee is forbidden for her. Is it better for her to start drinking hot chocolate in the beginning?
Well, it's a good start, sure. Or just simply go with the capsules. When we start looking at headaches, Mark Hyman, who was the past president, I don't know if he still currently is, of the Functional Medicine Institute, he said medicine has this thing that where he calls it name it, blame it, and tame it. They name the problem, they blame the patient's condition on it, and they try to tame it with the drugs. So they say, oh yeah, I know what your problem is. You have migraines. That's the problem. Let's tame it with 2 different drugs. Well, the gut has a lot more brain chemistry than the brain does. So when she's talking about having stomach migraines, it sounds like it's a neurotransmitter issue, but there's a lot of ways to balance neurotransmitters. And the sad reality is drugs can take down symptoms. That's good. If someone's suffering, I don't want them to suffer, but they don't correct the challenge. And in fact, by not figuring it out, it often gets worse. So Ganoderma is a good step in the right direction. And again, possibly a good consult with someone that has an understanding of functional management of that might be a good idea.
Okay. One of our friends' mom's been on spores 3 a day for the last 4 years, and she's had bone scans done every year for osteoporosis. Her last bone scan no longer showed the osteoporosis. She wants to know if the spores could have strengthened her bones.
There's a lot of factors that are associated with osteoporosis. Aging is one, too much acid in the body is another, decline in physical activity is another, not having the right growth factors of sex steroids is another. And so, Ganoderma is actually good for all of those factors. But if people actually get around and move and have a nice alkaline diet and manage their stress, or really Magnificent 7, right? Eat right, drink right, think right, move right, sleep right, poop right, talk right, everything gets better. So, it's probably not the 3 spores a day that's doing it, but the fact that she's overall better controlling the inflammatory process, maybe sleeping better, which buffers the stress hormones, probably having more energy to move around during the day. all those things can add up to a great positive.
Perfect. So far, that is the end of the questions. Does anybody else have anything else they would like to know? I've got a lot of thank yous. You're welcome, Gladys. That appears to be it for tonight.
All right. Well, then next week we do it again the exact same time. I take requests. This week I had the request for hormones. So I said, well, that's easy enough. I've actually taught full day seminars on hormones. There's a lot to talk about it, but the only way to have health is to earn health. How do you earn health? You make healthy choices. And every time you make a healthy choice, you move yourself in that direction. And that's what we're all about. Tomorrow, we do share a little bit about the Ganoderma business opportunity. That will be at 6 p.m. Central, 7 p.m. Eastern time, 5 p.m. Mountain. I see we have some Mountain people on there as well. So, password there is.
I have a question for you, Dr. Bob.
Yes.
How's the weather down there?
It's, well, we had, as far as I know, a
Cold.
100 the cold. So, but I celebrate.
I'm so used to seeing the palm trees in your backyard that this would be a good one.
We have had, every year we've had hurricanes, we've had hard freezes. And so we do have a very nice tropical backyard, but as we lost trees due to freezes, I bought more and more resilient palms. So we'll hope that these palms live up to their stated resilience. We'll find out soon enough.
Are you putting Ganoderma in the water?
Only if it comes through my sweat. So.
Okay. Thank you. Bye-bye.
Bye-bye. All right.
Have a good night, everybody.
Good night, all. God bless.
Have a good night, everyone. Thank you.
Thanks, Dr. Bob.
Bye.
Bye.
Thank you.